All right. I have two excellent people here to talk about what kind of research we need to do before the 2028 Olympics in LA. So I have Jonny Lisano and Liz Thompson here. And so go ahead and introduce yourselves. Who are you? Where are you? And what got you interested in this topic?
Yeah, I guess I'll introduce myself first. Dr. Jonny Lisano. I got my PhD in sport and exercise science at the University of Northern Colorado all the way back in 2019. Since then, I have spent my last 2 years as a postdoctoral researcher at the University of Colorado Boulder in the CU Change Lab, working on some kind of more related cannabis and health kind of based studies, but a lot of my kind of grassroots that I explored a lot during my PhD and even post that have been in cannabis and exercise. And so I'm just really happy to be here today and chatting here with you, Whitney and Liz.
Hey, my name is Liz Thompson. I'm a PhD candidate from Canada. So we have a little bit different cannabis laws up there. So it's allowing us to work on, we're running a clinical trial right now, which is partially sponsored by the NFL. And they're supporting our research to look at the reduction of neuroinflammation in the brain from concussion and contact sports. So my master's degree is in applied physiology and exercise physiology. So coming from a sports background, and my undergrad is molecular biology, so I like all the pathways and everything. So so I'm really interested in bringing the two together, looking at how cannabinoids can function in neuroinflammation. And as an athlete and somebody who's married to an athlete, it's super important to me because I've seen a lot of the negative downstream effects of concussion and things that we don't really have good pharmacological answers for. So I'm coming at it from that way. I think there's a lot there. So happy to be here.
Yay. All right. So the reason why I wanted to do this whole series about cannabis and the Olympics is because I've been kind of obsessed with, and Johnny probably knows this because I feel like I talk about it like every single time we meet about the Olympics are going to be in LA in 2028, where cannabis is legal. And so we're going to have athletes and spectators from all over the world coming to a place where cannabis is legal but it's still not allowed in sport. So, and when I say cannabis here, I mean like THC because CBD is technically off the list now. It's still like proceed with caution because there can be um, uh, what's the word I'm trying to find?
Cross
Mislabeling.
contamination. Yeah, cross
Yeah, thank you.
contamination.
Cross-contamination, mislabeling of CBD products that might have more THC than you'd think. And so that's WADA's kind of stance is like, hey, proceed at your own risk that you might test positive for THC still. So yeah, just generally, what are your thoughts on the legality or the use of cannabis in high-level athletes in international competition? WADA stance.
Yeah, I think Liz, I'll let you kind of tackle this first.
Sure. Well, I think WADA stance, I mean, I have a lot of thoughts on WADA stance. I think for like at a global perspective, it's very confusing because there's no fluidity to the rules. And so being in Canada is a really good example because in our country, cannabis is actually federally legal. So our athletes that are competing in U Sport, which is our equivalent to NCAA, they have it's not prohibited there because in our country, it's not actually illegal. So if they're an athlete that is competing just within the borders of our country, they're fully allowed to use it. They actually don't get tested for it. But if they're an athlete competing in Canada with the intention of international competition, now they have to abide by WADA rules. So now it's starting to get a little bit more confusing. And so I think that the lack of fluidity of the rules for athletes in general is a big problem. And I think that stems from the laws and the policies that are all fractioned, even within the United States, where I spend half my time. The fraction of the state regulations and then the federal regulations, and living within a state, which would be the case of LA, is in a state where it's state legal, but not federally legal. But maybe by that time that will have changed. But I just think the confusion in this entire industry and in this entire thing is just, it's so confusing. And from, talking to athletes and I spent a lot of time in my PhD talking to medical professionals that work with athletes, they're all completely confused. Like it's chaos. So I think before 2028, I really hope that a lot of the focus that we can do is kind of hammer out some fluidity of the regulations, because starting there, then once we have a solid foundation of what those are, I think we can build on the education. And, meanwhile, we can do the physiological research and stuff too. But until we have some fluid rules and stuff, it's going to continue to be a mess. That's just my opinion.
Yeah, I love it. All right, Johnny.
Yeah, I think, and Whitney, I kind of gave you a tease about this when we were conversing via email before this, but you asked the question of what research needs to be done, but before the 2028 Olympics, and Liz, like everything you said is spot on. Like we need a little bit more clarification on just, the regulatory standpoint and whether or not athletes can and should be using this. But as far as the research that needs to be done before 2028, I actually don't think we need to do any research before 2028 in order to kind of allow this to continue moving forward, kind of so to speak, with cannabis and athletics and just competition in general. We constantly, and it kind of pains me inside to say this, but we don't necessarily need to do research on cannabis and its effects on performance and what's it doing in the acute kind of use versus the longitudinal use of it. Because a lot of times we liken cannabis to other substances like alcohol, cigarettes, even opiates, like those sort of things. Like there's a lot of overlap between the uses, the misuses, and how we're kind of approaching these. And last I checked, there's not a lot of people doing alcohol and performance research for athletes to, if they took a drink before their competition or if they smoked a cigarette right before performing. Like, I don't think we necessarily need that research to be done right now in order to continue proceeding. Should we be doing that research? Yes. Like, we need to find out some of those answers kind of going forward. But I think as far as like what needs to be done right now, I think we're in a really good area. We just need to give these athletes a little bit more clarification, like Liz was saying, on can they use it? Is this going to potentially make them ineligible? Because we've seen this with previous Olympics where people test positive for cannabis right before competition and their country or WADA disallows them to compete. Like it's just one of those things. I think even before, and this isn't even cannabis related, there was I think a gymnast, I can't remember who it was that smoked a cigarette that was from, I think it was like China or South Korea or something like that. She smoked a cigarette and had an alcoholic beverage, and her team disallowed her from competing. So, like, athletes are going to have access to it. We need to give them the education in the next 4 years about what consequences that might have based on the current regulatory standards. So, if you're coming to acclimate, you know, before competition, whether it's a month before, 2 months before, 2 weeks before, like we need to give athletes like, hey, this is this information. If you test positive for THC, that could impact your ability to compete, something that you've worked so hard for. Maybe wait until after your competition in order to do that. So you're not putting yourself in a place of risk, or, just give them the potential, impacts that could have on them, I think is where things really need to go. I don't necessarily think there's research that needs to be done before that, because as we're all aware, research is a very complex, very lengthy process. Like 4 years in the research world is nothing. That's not even enough time to complete a full NIH funded study. Um, but yeah, that's kind of my kind of current standpoint. We need to do this research, but we also can proceed as normal. We just need to give those athletes education.
Yeah. Okay, so my brain's going like 10,000 different directions right now, which is always just so much fun talking with you too. But yeah, so the first direction I want to talk about a little bit is this this idea of like like comparing it to alcohol, where usually people are not using alcohol for medicinal reasons, and so I think that both of you have this like interesting vantage point in looking at cannabis, both from like, Johnny, you and I did our own surveys about cannabis use in people just exercising, and just like it's kind of more in the recreational kind of sense. I know that some people in our surveys were probably using it for like, different like medicinal reasons, but we're using it recreationally compared
Mhm.
to Liz, looking at it from a like I'm using this to help with neuroinflammation. Like that is a definitely like a different reason. And so WADA's current stance is basically like we don't really care if you're using it for recreational reasons, if you're just like using it to chill out with your friends at the end of the night, or if you're using it to help with your sleep or, certain levels of performance. We kind of don't care, but the fact that it stays in your system for so long is the reason why it ends up harming athletes to be able to compete in competition. So what are your thoughts on like this idea of athletes using it for recreational purposes versus medicinal purposes?
Um, I just have one thing, just that my light bulb just went off in my brain there when you were talking about. So that is one thing I think that makes it really difficult for any population is our ability to test when the substance was used. And I think that that's one place where research could really be done between now and then is to increase our ability to test when, like, so THC can stay because it's lipophilic, right? It stays in our fat for a really long time. And so somebody could have used it a long time ago and it could still show up on a test. And so, I think that the progress and the ability to test that so that it could give some validity to like, did this, I don't think anybody's using THC before a competition thinking it's going to enhance their performance. I mean, it's, I would, maybe they do, I think in some sports, potentially for the flow state aspect, maybe, but to have a test that would have the ability to, so that there wasn't any mistakes made, like somebody that used it a week or two ago in training and it just hadn't flushed out of their system yet. So, I mean, that would be potentially maybe one spot where some research could be done on the ability to test and the validity to time the tests for, the serum levels.
Right.
Yeah. Yeah, I agree. It's such a when you're talking about quantifying THC as far as like timing of use, like that's just it's even outside of just sport and athletics, like that's an issue
Right.
with a lot of just like DWI like research on, someone is driving,
Yeah.
they get pulled over because they're swerving, the officer smells cannabis and they go and they test positive, they get a DWI for that. Like,
Yeah.
but they may have not used in 48 hours, but because it's still technically in their system, air quotes around that,
Yeah.
you know, that holds a lot of consequences to it. And so, you know,
Yeah.
coming up with established methods or potentially devices that can help quantify timing of last use is really, really imperative. And I can't talk too much about it, but we do have a study going on here at CU Boulder that we partnered with a external company where we are working on helping develop a device and coming up with some methods to kind of shed some more light on that. It is like a handheld breathalyzer that you would work, in a very similar fashion to alcohol, but that's still very much in the preliminary like developmental phases, and that still takes time. We may have more data come 2028, but yeah, it's kind of a crapshoot out there for lack of a better word.
Yeah. And it's one of the biggest dividing things when athletes are choosing a substance to use. They'll lean towards alcohol because they know it's out of their system faster. And so if they're, nobody's testing me for it. And so if they're going out recreationally, elite athletes that I've worked with, they think about what they're doing. They're very calculated elite athletes, and their body is their most important and their most valuable tool. And so that sport is important to them. So if they're thinking about, well, if I'm going to get tested and potentially suspended or kicked off or whatever, they think about the difference between alcohol that's gone quickly and there's some other not so good substances that are also out quickly, and so they'll choose those because not for health reasons, because testing reasons, right? Because they think, well, it's out of my system, so I'm not going to get punished for it. And so you think of how convoluted that is, that they're choosing alcohol or these other substances simply to stay, compliant with the testing, where it's like, oh my God, like cannabis is probably a lot less harmful and the safety profile is a lot higher than these other things, but they're choosing, or they'll go for synthetic cannabinoids, which won't pop a test. And those can be not so good, right? I mean, depending on where
Yeah.
and how they were made, they can be terrible. And they'll choose them because they will keep them, away from the metabolites that pop a test. That is terrifying. And that is someplace where it's like, where you look back to the regulations, it's like, why do we have these regulations in the first place? And why are these athletes trying to avoid them? They're avoiding the test So they're choosing other things like synthetics or alcohol or other illicit substances because they can avoid that one test that they know is coming up.
Yeah. And kind of branching off of that too, discussing like the risks versus the benefits when you're looking at comparing multiple substances, you know, one reason that a lot of athletes and just the general population are using cannabis medicinally or recreationally is to help mitigate pain. So a lot of people are using it to help relieve their chronic back pain, could be potentially muscle soreness from exercise, or they're dealing with a lingering issue, and they may prefer to use cannabis to treat something like that. But if they're a professional athlete, going back to the point that you were just making, if they're worried about testing positive for THC on a test, they might
Yeah.
be more prone to choose a substance that's maybe an opiate or something
Yeah.
like that because it's more considered, it's prescribed, it's controlled by the doctors and all that. But we know just how dangerous opiates can be and how easily they can become addicting and overused, and they can lead to a lot of negative, side effects. And it's just it's one of those things where to me it's still so baffling the way we kind of treat cannabis within the world of just not only medicine but athletics as well, as it's this weird kind of mysterious substance that people are preaching as the devil's lettuce. But
Yeah.
we're already giving these athletes things that are so much more dangerous that could potentially have negative impacts on their health, where
Yeah.
cannabis could be a slightly less risky alternative to that. Are there some negative side effects of chronic cannabis use? Like, cannabis use disorder is a very valid and acknowledged thing within the world of substance use, and we have ways of quantifying and measuring that, but you're less likely to get addicted to a substance like cannabis than you are an opiate. So it's the kind of lesser of two evils battle that's going on there. And these athletes can't necessarily make that decision for themselves right now. They're almost being forced into using the more dangerous substance.
Yeah, so while we're kind of on that topic, let's go through the three criteria for why cannabis is on the list. So, according to WADA, substances are on the list of prohibited substances, and it's updated every year to if they meet two of three criteria. The first one, if it has the potential to improve an athlete's performance. Two, if it has the potential to harm an athlete. And then three, if it violates the spirit of sport. And so let's start out with does cannabis improve performance? And so when a lot of the WADA standard right now is based on a study from Huestis in 2012, which was before a lot of the research actually started getting going in the United States and in Canada and across the world. And so the if I remember correctly, the rationale in that was that it has the potential to help with sleep and pain relief, and so therefore it has the potential to improve performance. So, thoughts on cannabis improving performance? Oh, and also in anti-anxiety as well.
Yeah.
Yeah. I think going into like that, the fact that if people are using cannabis to improve their sleep or potentially reduce their pain, and that's becoming performance enhancing, that's such a load of shit. That's such a crock.
Yeah.
Like,
Yeah.
that's such a cop out. Because there's plenty of substances that athletes can utilize that are so quote unquote like naturally occurring that produce those same effects. You can use NSAIDs that are anti-inflammatories to help deal with inflammation and pain. You can utilize melatonin to help improve sleep. Like, there's a host of other substances that are producing the same effects that aren't banned and treated in the same way that cannabis is. And it's just, yeah, I know I'm
Yeah.
biased from my perspective and the type of research that I do, but it's such a crock of shit. And
Yeah.
yeah.
I agree. I agree too. And I think there was another paper I think too that they based it on, and this was like so mind blowing when I was looking at those like a while ago. It was one I think on cyclists, and so they were looking to see if the cannabis actually improved the cycling performance, and it didn't. It actually did not like it did not improve the performance, but it's a known vasodilator. So they theorized that because it's a known vasodilator, in theory, it could potentially help with circulating oxygenated blood, but it didn't. Like in reality, the cyclists actually performed worse. So one of the things that they were using to attribute it to being performance enhancing was the theory that potentially, and it was like, yeah, but in reality, the cyclist times were worse. So like, that was just such a leap to me. It was like kind of infuriating to see, because as scientists, it's like you can't take a jump from a theory to reality without proof, right? Like that's what science is. It's empirical steps to reproduce. And it's like you can't say that it's performance enhancing based on a theory if the actual cyclist actually performed worse. Like it was completely mind blowing. But yeah, I agree with Jonny too. Like there's so many other things. If we're going to qualify it as a performance enhancement and kick it out for that, then you'd have to kick out all those other things too as performance enhancing. So if you're going to, go way out in the riffles and consider like sleep enhancement and all that stuff performance enhancing, well then it's like we can't even eat, I guess, then, or sleep, because
So,
that's performance enhancing. So stop
Right.
eating and stop sleeping. That's
so
banned.
like my biggest like comparison to that is like, what's the most commonly abused drug across the world? Caffeine, right?
Yep.
Almost
Yep.
everyone consumes some type of caffeine every single day. There's a plethora of research out there that has shown that caffeine can have performance enhancing effects. Are we
Yep.
testing athletes for caffeine? No,
Yep.
like, it's not feasible. Like, it's one of those things where, it's just, they're, it seems to me that they're just picking and choosing what substances are allowed versus which aren't. I know it seems targeted at this particular substance
Yeah.
for some reason or another, which I can only speculate about.
Yeah.
Because caffeine does not violate the spirit of sport, Jonny.
Right. Yeah.
Yeah, exactly. But
Yeah.
to kind of further get into like the performance aspect of it, there's a pair of studies that I published in the Journal of Strength and Conditioning Research where we looked at physically active males and females, and we had chronic users and non-users, and we compared their performance across these tasks. Granted, it's a cross-sectional study, so it's not as good as someone that was not using cannabis and then started using cannabis and retesting them, but pretty much across the board, all these performances like that we had them go through. We did a VO2 max test, we did grip strength analysis, we did balance assessment. We threw a whole battery of testing at them, and the individuals that were chronically using cannabis were testing no differently than the individuals that were not using cannabis. In fact, on some more of the power focused performance testing, so the Wingate assessment, we found that our cannabis users actually had a tendency to peter out a little bit faster within those first 10 to 15 seconds of the Wingate compared to their non-user counterparts. So if anything, there may be some early indications that the use of cannabis, at least chronically, may in fact hurt your performance. So it's just, there's not enough literature out there yet. We're just kind of getting started into it. We can't make that definitive conclusion yet that it's performance enhancing. And going back to those 2 points that you said about mediating pain and improving sleep, it's such the, like, yeah, I've already said that, but
Yeah. Okay, now let's get into the second criteria. Does it harm the athlete? And if I remember correctly in the article, it's that it basically, a lot of the same old kind of stuff we've heard for like the last 40 years, 50 years about cannabis, how it can like lead to psychosis and all of like any kind of negative stereotype that we hear about cannabis, like decreasing balance could make people feel dizzy, that kind of stuff. So what are your thoughts on, does it have the potential to harm an athlete?
yeah. Liz, do you want to go first on this one, or?
I mean, I don't think it has any more potential to harm an athlete than a lot of other things that are accepted and not on the prohibited list. I mean, I definitely think that I think anything, if you drink enough water, you can harm yourself, right? Like, so I think their definitions really need to be clarified, really. So for harming an athlete, for me, does it have the potential to? Sure, it does, as do a lot of other things. But I think that it's getting picked on, and I think you know, yeah, I'm going to say no, that it doesn't have, but I think that what they're looking at is grasping at straws. So yeah, I'm just going to stop so I don't get kicked out of my program.
Yeah. No, I would agree. I don't think it places any more undue risk on the athlete than any other substances. I mean, we don't prevent athletes from consuming an excessive amount of sugar. We know that excessive sugar consumption can lead to metabolic disorders. Like when we're looking at these like longitudinal health implications, like we again, kind of going back to what we are talking about on the previous point, we're kind of picking and choosing,
Yeah.
right? There are risks associated with cannabis use that, it may potentially be addictive or can have a, propensity for being why can't I think of the word right now? But that like you can become dependent on it as a substance, but there's so many other things that we consume, like Liz said, on a daily basis that fall within those categories. And so I think we do, and this is where I'm kind of hoping a lot of my research is kind of headed in the future, is looking more at the long-term implications of cannabis use on just general health. If we're using cannabis regularly, daily, 4 times a week, what is that going to look like in our health kind of output, 10, 15, 20 years down the road? How is that long-term use going to impact us? We don't know. We don't have that type of longitudinal data quite yet. We don't know if it's going to have increased risk for cardiovascular disease or if it could potentially lead to, a
Lung
host of like
volume.
neurological issues or lung problems, or we just don't have the data to make those assumptions yet. We're still in such an infancy when it comes into the world of cannabis research. And the thing that, kind of grinds my gears too is a lot of the cannabis research that's been done out there isn't even utilizing products that are reflective of what people are purchasing out there on the legal recreational market. Like the this might come back to bite me in the ass someday, but it's pretty well published and pretty well established out there. The NIDA cannabis that's out there sucks. It's trash. It's ditchweed. Like it has been shown to have contaminants. It's only roughly about 7% THC, whereas the average like flower product that is available on the market is anywhere from 20 to 25%. So even the research that's coming out utilizing that, which is NIDA sanctioned, like it's not the best. And it's actually really hard to get access to that NIDA sanctioned cannabis. And it, yeah, it's just one of those things where like there's so little research already. And then you filter that research out, there's even less. We don't have a lot to make these conclusions on quite yet.
And even
And
even things like having a greater amount of CBD to THC ratio, something that would like you would test positive, but you're using so much more CBD than THC, like that's not anywhere in the determination either. Yeah, any other thoughts on does it harm the athlete? Because the thing I kind of go to as well is overtraining. Like overtraining harms an athlete so much more than money drugs will. And so I see overtraining as performance enhancing and harming the athlete. But that's my own little
yeah,
bias there.
I
Um,
think I think
yeah,
for them to be able to conclusively ever say, like to Johnny's point, to say, is it performance enhancing or is it detrimental to the athlete? We would need so much research to make a conclusion on that. But the problem with the research also is that you can have the research that's done, the results that happen are only particular, even okay, cross-sectional is particular to that one period of time, but it's only particular to that data sample and that population that it was actually done on. So it's really hard with any kind of cannabis or cannabinoid research to paint things with a broad brush stroke, because your population, if they're not athletes and you give them cannabis and you're looking for outcomes, that's going to be a different outcome. And we've seen it in some of the research that we're doing now just on athletes using CBG or CBD. And when you look at the outcomes and the performance and the changes, like even in myoglobin, the changes were seen, but only in the most elite of the athletes that used it. We didn't see the changes in normal, non-athletes. And so the amount of research that would need to be done to conclusively prove that in an athletic population, because remember, athletes also have different blood volume, different lean muscle mass, different. So the circulation of the cannabinoids are different. And so you can't pull a conclusion from research of general population or 60-year-old women or 20-year-olds or 12-year-olds. You can't pull that research conclusion and apply it to an elite athlete because that is not the same population. And it's a problem that happens a lot in pharmaceuticals, and it's a problem that happens in supplements. But when you look at the population that the research was done on, to then import that and apply it to athletes, we are so far away from being able to do that with cannabis and cannabinoid science right now, because we would need an elite athlete population to actually do the research on, right? I mean, we're just starting it. Our clinical trial is being done in elite athletes, but like it's applied to, they're all male, they're all football players, they're all, so like that wouldn't apply to me as a female athlete. And so we know there's genetic differences in the way that you metabolize cannabinoids, in the even sensitivity THC and stuff. So like for them to conclusively say it's enhancing or it's detrimental, that's impossible right now. We don't have the data to show that, and we're really far away from ever being able to do so. So I think the spirit of sport is the one that just is like blows my mind. I don't even think I should talk about that one. I'll get kicked out for sure.
Well, and kind of bouncing off what you were just saying as well, is like there is some research out there that shows that females may be more sensitive to the effects of THC than males. So
Yep.
are we
Yep.
going to look at, if females are more prone to the effects than males are we banning THC just for females? Are we not
Exactly.
banning it for males? Like,
Yep.
are we banning it across the board because one, gender can't utilize it? Like, where are we kind
Exactly.
of drawing that line? And one thing that is really interesting, so we actually have a research assistant that is presenting some data at an upcoming conference that is suggesting that individuals who are physically active may actually be more sensitive to the effects of THC than those that are not physically active, because there is some established literature out there, mainly in animals, that suggests that engaging in regular physical activity can actually uprate our expression of CB1 receptors in the brain. And so
Yep.
if we have more CB1 receptors, we're talking about coincidence of THC interacting with those receptors, you're going to be more sensitive to those results. And we're seeing that is kind of the case with some of the physiological parameters that we're looking at, particular heart
Right.
rate. So like Liz
Yep.
was saying, like it's so difficult to make such a conclusion like that on something that there's so little research on. Does it hurt the spirit of sport? I don't know. Like we'll get into it a little bit more, but yeah.
Yeah, and then the other thing along that same line is that with potential for like psychosis or like some kind of mental health problem with cannabis is that I feel like people kind of figure out really quickly, like within the first or second time that they've used cannabis, whether it's for them or not. People who have
Mhm.
like really bad effects of cannabis are not going to use it. Like they're they might use it one time, have a bad time with it, and then just never use it again. So there might be a certain level of like, yeah, people that it works for, they don't have a problem with it. But for the people that it doesn't work for, okay, fine, it's not for you.
Yep.
Um, but yes, okay. So now the hotly contested third thing about violating the spirit of sport. So, according to the World Anti-Doping Agency, it violates the spirit of sport because it is illegal in most countries, and athletes who are representing their countries have to be good role models for their countries. So, thoughts on the violation of the spirit of sport?
Yeah, so when we're talking about this in the whole like spirit of sport, like it's always kind of hindsight is 2020, right? We can always shed so much light on the situation, after we have kind of more information from the future, right? I go back and I think to like some of my like childhood like sports heroes that I like really looked up to. And the person that for me was at the top of the list was Lance Armstrong. I mean, world renowned like cyclist, he was doing things that no one had ever done before. And it comes out years after his career, like there had been some allegations during his career, but years after, he admits to this whole doping scandal of using EPO and various other substances, and it had been basically the entire time that he had been going through competition, but he was always one step ahead of those people that were testing for the drugs. And he's like, we had it down to a science. And like athletes are going to be using substances regardless. They're going to be using alcohol, they're going to be using other drugs, like Liz was saying, like they have a preference for those because they get flushed out of the system, quicker. Why should cannabis be viewed as any different? It has some potential medical benefits. It can be used in just recreational, just social settings. Like, we are putting these athletes up on pedestals, and we can idolize them however much we want, but that doesn't change the fact that there's still these individuals that can make their own decisions, and they should be allowed to use within reason the substances that they want to use. Like, I don't think we're going to see a whole bunch of athletes out there just smoking a joint on the street while the paparazzi's taking pictures of them. Like, I and even that, like me now as like an avid hockey fan, like if I found out one of my favorite players was smoking a joint on like an off day or something like that, I'd be like, cool, good for him. I hope he's relaxing and getting recovered, and that way he's ready for the next game. Like, I I know that's probably the spirit of sport aspect is primarily probably geared towards like children, right? But I mean, those athletes are still using alcohol. They're still using nicotine. Like, it, how is cannabis any different? Yeah.
Yeah,
Yep.
I totally agree with all of that. And I think that the question at the end of the sentence there really brings it all down to it is it's different because of the laws. And I think that they're just playing moral police. And now because the laws with cannabis are incorrect in my opinion. Like I don't think that they should, because in Canada, and here's the thing, we legalized in 2018, and guess what? Like everybody didn't turn into Cheech and Chong, and cats didn't start marrying dogs, and like nothing happened. It was like everybody thinks, oh, this is going to be so terrible if we federally legalize. No, not it didn't. And actually, our youth use went down slightly once we legalized it, and our education material and curriculum has gone up. So if you look at our country, it people didn't go crazy. It didn't, and so the spirit of sport, I think that they just use that as a way to play the moral police within the Olympics in a way that they can then, because I think to qualify as banned, you have to have two of the three. So you can always take the spirit of sport and one of the other two and put it together, and now you have two of the three. So whatever they decide. And again, a good example with cannabis is when CBD came out of and it stopped being prohibited because the law changed in the US because the Farm Bill in 2018 took CBD out. And then just coincidentally, WADA followed right along and took it out too. It's like, well, hold on a second here. Like, well, now it's okay with the spirit of sport. What changed? Oh, well, the law changed. That's what happened. The law changed in the United States. And so I think that when you look at the spirit of sport, that can also be like a translation for our sponsorship money and the people and the funding and the money that's behind the Olympic Games. And I think that's one place and that's one place maybe when you think about what research could be done back to the original like whole context here is maybe they can start to do some research on changing public perception and the social impact of maybe using the LA Games as an opportunity to show that this is a substance that can be used responsibly. And it's also the chosen medication for a lot of athletes that right now can't use it. Like I have lots of female athletes, it works wonderfully for menstrual cramps, but guess what? They can't use it in the NCAA because they'll lose their scholarship. Is that fair to them? No. And they just pump them full of NSAIDs till their liver falls out. Like this is not okay. If that's their chosen medication that they're using for that right now, they would get punished for that and they can't use it. And so looking at it from a perspective of a medication, a truly valid medication on things that nothing else works. And so instead, well, what's against the spirit of sport? You're making them suffer then. They can't use it. So isn't that against the spirit of sport? Or they can't use it for something where they would use it for maybe anxiety or even motion sickness, which a lot of athletes use it for. Well, wouldn't that be against the spirit of sport to tell them they can't use that? Well, now you're making them suffer. So who's, I don't know, but I think that would be against the spirit of sport too.
There's also an aspect of which countries is it legal in, and so in countries and for the United States, which states is it legal in? Then people who have access to cannabis, whether it's THC or CBD even, then they could potentially have this benefit that people in countries where it's not legal and they don't have access to it. Then now there's this like weird competition
Yeah.
based on just legality in different countries.
Yeah.
Mhm.
And if it
Yeah.
truly is impactful for recovery and rest and stuff like that, then it would be an advantage to athletes that can use it and athletes that can't, right? Like we look at in the NHL, because that's the one professional league that splits the countries. Half of the teams, well, not half, six are in Canada and the rest are in the States. So if you think of the advantage of the people, the athletes that are in places where they can access it, and the NHL doesn't have a it's not prohibited in the NHL. So you're at an advantage if you're in a place that has, you know, different products that you can use and people that know how to use them. So wouldn't that be an advantage to them if they can recover and rest versus the other, you know, maybe it would be a disadvantage to be in, say, if you're in the deep south, like maybe if you're in Nashville where it's like completely not okay. Well, then you have to start to think about who you're disadvantaging then. You know, it's not equal and it's all supposed to be about equality and now it's not.
Yeah. I think, just kind of spitballing this too, like one of the biggest advantages to potentially having the Olympics in LA in 2028 is we're going to have this large influx of international athletes that are coming to an area, like Whitney said, that it is recreational legal. Whether those athletes choose to use or not, that's up to them. They need to kind of make that decision for themselves. But going back to some of our original points on just education, you know, this the Olympics would be kind of the perfect opportunity to collect a large international sample on just cannabis education among these athletes. What are their perspectives
Yeah.
on it? Do they view it in a positive light? What do they think THC and CBD are the exact same thing? Like what information do they have on these
Yeah.
substances? Because like Liz, like you said, that might vary from country to country based on the legality. So you might
Yeah.
get someone that's an athlete in Canada that comes down and they have a very positive viewpoint on it because it is recreational legal. It's more common within their country. But you might have someone from, let's say, Asia or the Middle East that comes and they have a completely different viewpoint on it. And that's largely impacted by their laws and their culture. Like, this is such a great opportunity to potentially,
Yeah.
explore this understanding a little bit more in these athletes so we can start to address, okay, this is what the athletes know. This is what they kind of perceive. Here's some of their misconceptions. Here's what they have right. We need to give them education so they can make well-informed decisions because a lot of times their coaches are just like, hey, here's this thing, you're going to start taking this. Well, I
Yeah.
think we need to give a little bit more accountability back to the athletes and give them the ability to not only question what they're allowed to use, but what they're actually putting in their body, because they have a more well-informed and well-rounded decision to make around that. So,
Yeah. And I think that's starting to happen here too. I think that is where the push is coming to change the regulations on cannabis because the athletes are
mhm.
questioning, like, I want to use this as my medication. I don't want to use that you're giving me, tramadol or Tylenol. Like, I want to use this instead. And so under the regulations, it's like, okay, well, who's calling the shots on my body then? Because I have to live in it when I'm 45 and now my stomach is chewed up or, like it's, and I think they are starting to question it even in this country and in Canada, it's like they're starting to ask questions and they are looking at it as an alternative to recreational substances, but also to medicine. Like they actually are truly looking at it as something that works for them instead of other prescription medications. And they get better results, some of them, and some of them, they like it better. And so that's kind of a problem when you look at how the whole setup is going. But yeah, internationally, it's just like this is just a microcosm of like the whole globe because when you go piece by piece, like I mean, it would be super interesting because I'm sure in some of those countries they just think like you'll go crazy if you touch it. Like,
Yeah. Oh my gosh. Again, my brain's going 1,000 different directions and I've already taken up so much of your time. And I know that, between the three of us, we could probably talk about this for another like 2 hours. Um, but yeah, I think this gives people like a really strong overview of why is it illegal. And then, either now my brain is thinking like, okay, either we turn this into a really cool experiment where we actually do a survey of athletes' perceptions and coaches' perceptions, because I know, Liz, you're doing that kind of research as well. But then also, or it's an opportunity for us to create that content of educating the public while they're in California.
well,
We can
it
say,
might.
hi, welcome to California. We know what's legal here. here's how to use it
Yeah.
responsibly. Here's some information
Don't eat the
about it.
100 milligram edible. Do not start with 100
Start
milligrams,
low, go
please.
So
slow.
so kinda similar to, like, you know how they just hand out condoms like they're candy in the Olympic Village, right?
Yeah.
Just flyers with, like, cannabis education, like, "This is what you
Yeah.
need to know," like, quick facts, like, "This is what you can't use," like,
They
that sort of
should.
thing.
For
Yeah.
sure, because the international people coming from other countries, like even in coaches that I've spoken to that lived in other countries and then moved here, they didn't know anything because in their country it was just completely prohibited. And then once they moved here, they learned so much. But it's true, like they wouldn't have a clue. So maybe even not even the athletes, but their entourage, we got to give them education because they're not competing. So they'll be like, "Woo, let's try this," because why wouldn't we? We're in California, right? So they're going to be scraping up people grinning out on the sidewalks from like we better make some pamphlets.
Watching some, high level Olympics, on high level, Great California.
Exactly.
Mhm.
Oh my gosh. Well, thank you so much, both of you, for taking the time to talk to me about this, and talk to the audience about cannabis and exercise and sport. And yeah, I'm so excited to see what we'll do in these next 4 years, potentially collaborating on getting that education out to the Olympic Village for 2028.
Yeah, that's a great idea. I like it.
Awesome. All right. Well, thank you so much. I'm going to press stop right now.